Gather the required examination equipment. You will need a tongue depressor, headlight or pen torch, and a cup of water. Ensure appropriate infection control by decontaminating your hands and putting on the required PPE. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. The patient should be positioned sitting comfortably. Ideally, the examination is best carried out with the patient sitting in a chair, with space available behind the chair for the person carrying out the examination. Make sure the area to be examined is adequately exposed, whilst also taking care to maintain privacy and dignity. Assess the patient for any distress and ensure they are well enough for you to proceed. Look for any signs of airway obstruction, such as stridor or respiratory distress. Ask if they have any pain or other symptoms, clarifying the location affected. Note the presence of stertor or hoarseness. The examination follows an inspect, palpate, oral and throat examination structure. Look in a systematic way from the mandible to the clavicles and then out to the acromioclavicular joint for signs of infection, swellings, or scars from trauma or surgery. Inspect for masses and asymmetry, including during swallowing, by asking the patient to take a mouthful of water, hold, and then swallow. Palpation of the neck in ENT is performed in a systematic fashion, following the lymph nodes of the neck. While in the appropriate areas of the neck, you will also be feeling for certain glands, including the parotid, submandibular, and the thyroid gland. As you examine the neck, consider if there is any swelling in the nodes or glands. Are any prominent? If so, is it unilateral or bilateral? Is the swelling firm, rubbery, soft? The textbook way to perform this examination is from behind the patient. Be sure to inform the patient of this before you begin the examination. Begin by palpating using your fingertips. Start at the submental nodes, followed by the submandibular, parotid, pre- and post-auricular in turn. While over the submandibular and parotid, feel the gland and compare the two sides. Follow the cervical chain inferiorly along with the path of sternocleidomastoid muscle. Compare the sides, but be careful not to examine both sides simultaneously, as this may cause a vasovagal episode. Inferiorly, palpate for the supraclavicular nodes. Complete the anterior triangle of the neck by palpating the thyroid for any thyroid lumps. You may wish to ask your patient to swallow a sip of water at this point to assess for movement of any thyroid swelling. Complete the palpation of the neck by examining the posterior chain up the sternocleidomastoid muscle to the occipital nodes. Examination of the oral cavity involves the use of a light source, ideally a headlight, but more commonly pen torch and a tongue depressor. Consider appropriate protective equipment, including gloves, mask, and eye protection, as you come into direct contact with the patient's oral cavity. Examination of oral cavity mainly focuses on inspection. Begin by inspecting the patient's outer mouth and lips for any obvious abnormalities or asymmetry. Ask the patient to open their mouth as wide as possible. Do they have trismus? This is approximately when the mouth opening is less than 3.5 centimeters or 2 to 3 finger breadths in an adult. Ask the patient to keep their tongue inside their oral cavity as you obtain views of their oropharynx using the light source. It may help to ask them to say ah or deeply inspire through the mouth. You may need to utilize a tongue depressor as well to help. Look for any obvious asymmetry of the palate, uvula, or palatine tonsils. Are the palatine tonsils inflamed or enlarged? Have they been removed? Look at the posterior pharyngeal wall for any obvious erythema or swelling. Examine the buccal surfaces of the mouth by asking the patient to push their tongue left, then right, into each buccal surface in turn. Look at the lateral aspect of the tongue while they do this for any obvious lesions. Ask the patient to lift their tongue to touch the roof of their oral cavity. Are there any obvious swellings in the floor of the mouth? Consider palpating the floor of the mouth. Normally, this should be soft. The final step before completing the oral examination is to comment on the patient's dentition and overall oral hygiene. To finish your examination, consider the functions of the neck. Ask the patient to speak. Is their voice normal or hoarse?
Can I get you to speak? So I just want you to say E. Good, that's great, thanks.
Ask the patient to swallow a small sip of liquid if you haven't done so already. Is there any dysphagia or regurgitation? Listen to the patient breathing. Is this normal, or is there any stridor or stertor? Finally, ask the patient to slowly rotate their neck left and right. Then do this against resistance. Place their chin on their chest and look up to assess for any restriction of neck movement. During your examination, you have tested the lower cranial nerves 9 and 10 with swallow and voice, 11 with neck movements, and 12 with tongue movements. Perform appropriate infection control by decontaminating your hands. Thank the patient, then allow them to dress. Explain your findings to the patient and complete appropriate documentation in the clinical record.